everyone, welcome to Origyn IVF. I am Dr. Rashmi Sharma, Director of Origyn Fertility and IVF, and we have been speaking about PCOS, and we have reached on the fourth video of PCOD or PCOS, and in this video we would be dealing with treatment of PCOD or PCOS. Before that, if you wish to consult at our center, the number is given below in the screen. You can give a phone call and you can come to at any of our centers which are located in Delhi. If you want to teleconsult, like you are not in Delhi and you want to teleconsult us, then the app link is given below in the description box. You can you can connect to us through that teleconsultation app also. So till now we have talked about how PCOD happens, why it happens, then what are the lab tests that you should be doing, and we also talked about that what you can do yourself for your treatment, which is lifestyle modification. And now we come to the fourth and the last video, which is how do doctors treat symptoms of PCOD or PCOS. Okay, so I would say the PCOD, is affecting all the three stages of a woman's life, and the symptoms are different in each life stage. So the treatment also accordingly varies according to the symptoms. Okay, so if a patient comes to us with a history of menstrual irregularity, she's worried with irregular periods, so there would be certain hormonal drugs. Sometimes it is the oral contraceptive pill which is given for 21 days, and sometimes it's just a 5-day tablet which we tell the patient to take regularly. Okay, so this is just a simple treatment, and I would like to recommend here that you should not let the periods delay beyond 2 months. Okay, so there are many women who do not have periods at 3 months, till even 3 months, 4 months, 5 months, and they're not taking drug. They're not taking drug to bring about the periods just because of the fear of the hormones. I would say that drug will not do any harm, but if you're waiting for long for your periods to come, that will harm you. Because as we had talked about in earlier videos also, one of the side effects of having PCOD is developing uterine cancer. That the cancer of the uterine lining later on in life, in about 50s, 60s, 70s. And you can prevent this. How can you prevent this? By having regular periods. It is said that if you wish to prevent uterine cancer, in a case of PCOD, there should be at least 6 periods in a year. Whether it is through medication or without medication, it doesn't matter. So please do not do not neglect this and get hormonal drug for bringing about your periods if you are suffering from that. Then the other symptoms like acne and hair growth. For the acne, there are many acne creams available, and lifestyle, of course, if you lose weight, all the symptoms will be little lesser. For the excessive hair growths on the beard or on the chin or on the mustache, cosmetic treatments will be better. Either temporary cosmetic methods or permanent cosmetic methods. Temporary means bleaching or waxing, and permanent means laser will be better rather than going for hormonal or medical treatment for excessive hair growth. So sometimes for this excessive hair growth, we do give certain drugs which are anti-androgen drugs, anti-male hormone drugs like spironolactone, and sometimes we also give oral contraceptive pill which contains cyproterone acetate. Okay, but the problem with these drugs is their effect is temporary. So, and you will have to take them at least for 7 to 8 months before you can see an effect. And at the moment you stop the drugs, the effect will wear off. So there's no point. There's no point taking so many hormones for something for which cosmetic treatments are available. Okay, so for hair growth, my preference would be to go for a cosmetic treatment for my patients. Okay. Then coming to the symptom of PCOD during the reproductive age, the biggest symptom, which is the infertility. So if a couple is suffering from infertility and the lady has PCOD, the first advice that the doctors give is the lifestyle modification, about which we have talked in detail in my previous video. The second step for us is to give drugs to form an egg. Why the lady is not conceiving in PCOD? Because she's not forming an egg. So of course the treatment is very simple. We have to induce ovulation through certain drugs. Okay, so sometimes they are just oral drugs in the form of letrozole, then sometimes clomiphene. Okay, and many of the women will ovulate with just simple oral drugs. Then there will be some women who have a little severe form of PCOD which will not ovulate through simple oral drugs. In those women, we like to add a drug called metformin. Okay, metformin is basically an insulin sensitizer agent. We had talked about this in earlier video that PCOD is related to insulin gene, insulin resistance. So there is a drug which improves the sensitivity of insulin, and that's how it helps in PCOD. So there will be many times chemists will be telling you, oh, this is a sugar drug. The doctor has written metformin, and the doctor failed to inform you that this drug is also used for patients of diabetes. The chemist will be informing you, madam, do you have sugar? And so many times the patients, they panic. So please do not panic. Metformin we are not giving for sugar, we are giving to you for PCOD. It is given if you're not forming an egg with simple drugs, or if you're very obese, or if you're diabetic, if your sugar levels are already high. Okay, so this is the second type of drug that you like to use. Then if there is a patient who is not ovulating with simple oral drugs, then what do? Then there are injections available. Okay, there are gonadotrophin hormones, which are FSH and LH, which are available in the form of injections, and it's very highly monitored treatment. So this kind of treatment, I would say that you should be going to a proper infertility specialist or an IVF center, because there are risks involved with injections when we are using them in a PCOD patients, right? It's like an edge of sword. If you give less injections, the egg will not form. If you give more injections, there will be so many eggs. There could be it could be like a volcanic eruption, that you are forming 10 eggs here and 10 eggs here. So, and there could be 2 complications following that, which could be ovarian hyperstimulation syndrome, which is a dreaded complication of PCOD. And the second could be multiple pregnancy, because if there are many eggs forming, of course, you may have as many number of babies as possible. So these are the 2 complications for which infertility specialists, they take very careful approach whenever they are giving injections to a patient of PCOD. Okay, so this is the third type of treatment. The fourth is, even with injections the patient is not forming an egg, then what do? Then we can go in for a surgery which is known as ovarian drilling, in which you put in a telescope. We put in a telescope inside the abdomen and see the ovaries. Ovaries are pretty big, and we drill the ovary. Around 4 or 5 punctures we make in the ovary. And it is assumed that by doing the drilling, the hormones will improve for some time, and ovaries, they become sensitive, and now our drugs will act better. Here also a word of caution. The drilling should be done in expert hands. It should be done by an infertility specialist or a gynecologist who is sensitive about the ovaries, because sometimes there have been cases where too much drilling had been done, and instead of having too many eggs, the lady ended up in ovarian failure and losing whole of ovary. Okay, so one has to be very careful where we are getting the ovarian drilling done. Okay, so these are the treatments for making eggs, and there will not be a single patient of PCOD who will not be forming egg with these approaches. Okay, step by step they are taken. First you give oral drugs, then you give injections. If injections don't work, then you give drilling. Now coming to what do we do when the egg is formed? Okay, so the egg is formed, it has come into the tube. There could be 2 treatments. One is you try naturally, which is timed intercourse. The second is you also add on intrauterine insemination. That is, you take husband's semen, prepare it, wash the sperms, and take good motile sperms and inject it very simply into the uterus. Okay, so the normal try chances are 7%, the IUI chances are 15 to 20%. So my personal opinion is that when we are taking so much of efforts in making eggs, patient is coming 3-4 times of follicular study, she is forced to take drugs for making an egg. Why not add a very simple procedure which is IUI also? Though there is 80% failure of IUI, but it is 3 times higher than natural try, and it's very simple, painless, very less expensive management. So this is the second treatment that you can do, that is IUI. Then if a patient, let's say we have done 2-3 IUIs for the patient has still not conceived because the success rate of IUI is 15 to 20%, then the next step for this couple to go forward will be IVF treatment, that is test tube baby, in which also we give injections, 10-12 days of injections, and try to make multiple eggs in the ovary, 10 here, 5, 10 here, whatever number is available. Then you pick out those eggs through ultrasound under anesthesia. It's a painless procedure, safe procedure. then mix those eggs with the husband's sperm outside in the lab, make the baby outside in the lab, and then put that embryo or the baby inside the uterus, which is known as test tube baby. Good thing in PCOD is the success rate of IVF in PCOD patient particularly is very high. PCOD is kind of a boon for IVF because there are so many eggs. Once you give even little bit of injections, patient will end up having 15, 20, 25 eggs. So when there are so many eggs, what will happen? You will form a lot of embryos also. Let's say you have formed 10, 12, 14 embryos. Of course, we're not going to put so many babies inside. We are going to put only 1 or 2 or maximum 3 embryos. So what happens to the other embryos? The other embryos or the other babies are frozen for future. And the technology of freezing these days has become so good that not only the results of frozen embryo transfer is equal to fresh, but better than fresh, especially in cases of PCOD. So when there are too many eggs, like more than 15 eggs, we don't like to transfer fresh embryos. In PCOD patients, we like to transfer frozen embryos. And IVF, kind of take care of the 2 dreaded complications of PCOD patients. One is ovarian hyperstimulation, second is multiple pregnancy. Ovarian hyperstimulation also will not happen if we are not making the woman pregnant in that cycle because we are freezing all the embryos. And secondly, multiple pregnancies also will not happen because it is our choice that how many embryos we put in. We can put in just 1 selective single embryo transfer, we can put in just 2. Very rarely we can go ahead with 3 transfers, 3 embryos in the case of previous failures. So it's not like that 5-10 eggs have formed and all babies have implanted like in IUI. Okay, so this is how we do treatment stepwise in a case of PCOD. Okay, I hope you will you must have gained a lot from this video, and if you like the video, please like and subscribe our video. If you have any questions, you can write down in your comment section and we would like to answer them. Thank you so much.